My name is Dr. Arup Ratan Mallick. I'm a consultant physician practicing in North Kolkata of West Bengal. So today we are going to discuss two important topics which is very commonly is available in many of the patient, but patient are unaware of that, and often it's misleading the patient. One is asthma, one is gastroesophageal reflux disease, which is commonly known as GERD. And whatever the treatment available, whenever we are getting some symptoms related to this GERD, right or wrong, we oftenly opting for PPI. But before going into that details, we need to understand the link between these two diseases. So move on to first, that is asthma. Asthma is a condition in which areas in the lungs become narrower, that is bronchoconstriction, and it eventually leads to the breathing difficulty. So, and all of us actually aware of asthma that we need sometimes some kind of inhaler or nebulizer. So, but the main treatment is always away from the triggering factor. So, what happens in asthma? It is usually caused by certain allergens or things that might irritate the airways in the lungs or overall the airways. And it has been found that more than half of the people with asthma actually also having this GERD, gastroesophageal reflux disease. And this GERD can worsen the symptoms of asthma and is more common in people with asthma compared to those who are not having this asthma. People with difficult to treat asthma, that is quite difficult, not responding or resistant asthma, are more likely to have this GERD. So how these things happens, I mean, how these two factors is connected to each other. When our stomach acid leaks, that is the actually main source of acidity that we are having acidity. So this acid leaks back into the esophagus, which is a junction, I mean, which is a connecting pipe. That is, we also sometimes we call food pipe, the tube that carries the food from the oral cavity or our mouth to the stomach. So this esophagus is a connecting junction or tube. The acid irritates the nerve ending in the esophagus, specifically the esophageal gastroesophageal junction, and sending signals to the brain. So after receiving that signal, what happened? The brain responds and send message to the lungs, that is our respiratory system, and which leads to and after that, getting that signal, lungs responds like that way, that it leads to the tightening of the muscles, that is the airway muscles or respiratory muscles, and along with that, it causes the formation of the mucus. This makes the airways in the lungs narrow, leading to the bronchoconstriction, and further we may see the symptoms of asthma. Bronchoconstriction to leads shortness of breath, and followed by sometimes wheezing and other symptoms. And sometimes these contents from the stomach, that is the food contents mainly, or acid can go directly into the lungs, leading to aspiration. And obviously, we should all be aware of that. This aspiration sometimes may lead to aspiration pneumonia, which is pretty bad thing. So these contents from the stomach then irritates the airways, leading to other symptoms of asthma like wheezing, coughing, chest tightness, and other symptoms. So asthma related to GERD can happen to anybody, of irrespective of the age, like baby, parents, teenagers, and rest of the elderly population also. Certain people may have GERD symptoms sometimes, while others may have them all the time, like every time. So symptoms can also happen after eating certain foods, or in a few cases due to food allergy. So this allergy actually triggers the asthma symptoms. When symptoms of asthma are caused due to GERD, we might notice a certain few things. But symptoms of asthma often happen after a big meal, heavy meal, grand 5-course meal or something, or a rich wedding venue or something. We might happen those symptoms. Your asthma gets worse at night while you sleep. Your asthma worsens in middle age, and the symptoms are not related to those triggering factors, I mean those triggering allergens or infections, specifically viral infections. Your voice may often sound harsh, rough, or strained. Usually your voice normally it may vary from the normal variation of your voice. you experience frequent coughing occasionally while you are talking with someone or giving a speech in the lecture, or lecture in the classroom. Sometimes you may have this choking or this coughing like feel, and your asthma may not improve with usual medications because there are certain factors which is not usually not known as allergens that actually causing this triggering of the asthma. So we have to treat those uncommon findings. So GRD is on one of those uncommon link of this triggering asthma. So there are certain do's and don'ts we should keep in mind if you have asthma and GRD. So first of all, in this video, I want to share that I am not talking about any medicine today. What I am talking that all disease, there are certain disease or most of the disease, we shouldn't rely on the medicine always. There are certain rules, certain discipline we have to maintain. So first of all, eat smaller meals more often throughout the day. In case of asthma and GRD, when coexisting in a patient, limit foods and drinks like citrus, tomatoes, spicy foods, caffeine, colas, fatty foods, chocolate, peppermint, and most importantly, alcohol. I know it's very difficult to avoid these things for a lot of people. While sleeping, raise your head 6 to 8 inches from the bed or use a thin pillow, not a thick pillow. Maintain a healthy weight. That is another difficult thing because once you have that, it's difficult to lose it. Relax and manage stress. The line itself is stressful for a lot of people that how can I relax? But yes, we have to try for that. Take your medicine for asthma regularly, which is another, patient-related factor because patient thinks that I'm not having any problem. I'm not having any breathing difficulty. Why I should take those inhalers or some? No. Where his physician has told him or her to take those medicines frequently, regularly to prevent further attacks. People are unwillingly to follow this. Now, avoid asthma triggers as much as possible. So, have to use mask as much possible to avoid those triggering factors, pollutants, pollens, dust, etc. Avoid eating 2 to 3 hours before going to bed. And most importantly, do not wear tight belts or clothing around your waist. And most importantly, avoid smoking, which is a very important factor for asthma as well as this esophageal disorder. Because asthma or tobacco plays an important role here. So when asthma and acid reflux happen together, medicine for asthma might not work for some patients. So in that case, treating acid reflux can help improve your symptoms. If you have asthma and think you may have acid reflux, talk to your doctor about the best possible treatment. Some asthma medications like theophylline can make acid reflux worse, but do not try to treat yourself. Do not stop or change any asthma medications or any other medication without talking to your doctor. So the last summarizing message is that observe your symptoms, follow these do's and don'ts. If you don't understand anything, if you are having problem after following all these rules regulation, talk to your nearest physician available or your regular physician. And without consulting him, you shouldn't take any drastic decision. Thank you. That's all for today.